Everyone. This is our student series. This up and coming episode will talk about some of the common traps that Chinese medicine students and recent graduates fall into in practice. This episode, I'm going to talk about the herbal formula trap. What is the herbal formula trap? Why is it a trap? And how it came to be, and the impact of this trap to you in practice. So through learning about this trap, I hope to show you the way that I think is the true way of practicing Chinese medicine, at least the beginning of it. How do you prescribe? These following steps here: diagnosis, determine treatment, and prescription, is probably most of what you have learned in school and how you have been practicing. You start with a diagnosis, which collecting all the patient information about their complaints, and you further to that using the 4 diagnostic methods. You gather all that and you will determine through your diagnosis what the disease is or the syndrome is, and from there you will use that information to determine treatment. And that treatment could be through acupuncture, it could be herbal, it could be tuina, and whatever methods that you have picked up. And from there you kind of prescribe, right? Whether it's acupuncture, herbal, or even tuina, you actually have to determine what are you going to use, how are you going to use it, right? What acupuncture point, what formula. And unfortunately, a lot of us learn from school is mechanically applying a formula or combination of formulas with some minor additions. And I think that's the main topic that I want to talk about in this episode. Mechanically applying formula or combination of formulas is not the most effective way of prescription development for herbal formula. And I will demonstrate to you throughout the series some of that chapter as well. But for here, we focus on the herbal formula and how it should be done. How did you fall through this rabbit hole? I've outlined 4 types of reason. First one is the textbook approach. I think all of us have been through classes and formulas or internal medicine, external medicine, pediatric, gynecology. And as we study these subjects, I think the usual format is, they list them, a series of diseases. And under each disease, they study the symptoms, the manifestations, how you will diagnose the disease, how you classify it, there are subtypes, and each subtypes there is a formula, right? So if it's dampness, heat, then you apply a formula. If it's yang excess, you apply another formula. So, and it goes on and on. So each of us will learn that, okay, for this disease, for this subtype, we apply this formula. It's natural. That's what we learn. That's how we are taught. So a lot of us just took that into practice. The second category is really the celebrity effect. And I think it is common for us to, especially when we're studying or when we just recently graduated and we don't have a lot of experience, and it's easy to fall into this kind of path where, wow, okay, there's a lot of other more experienced practitioners or clinicians that was very successful, right? And there were thousands of formulas created throughout the history of Chinese medicine. So you naturally tend to rely on that and saying, hey, it is something that I can rely on because they are more experienced. They have been, seeing a lot more patients, and I hope to make their success. The third category is disease focus. This is kind of the allopathic medicine way of doing things, where they prescribe drugs to a specific disease, right? So they will have a certain pharmaceutical drugs for headache, like aspirin or Tylenol. Some are over the counter, some have to be prescribed, and we want to, mirror that kind of approach, where we would like to have a formula or a set of formulas for that specific type of disease or syndrome. And the last category here is kind of the why invent the wheel kind of category. What's not broken, we don't need to fix it, right? So why mess with something that is working? So I think these 4 types of categories, probably there are more, but I think what I've outlined here is kind of what most of us, I think over 80% who view have, when you're studying Chinese medicine or we just recently graduated, and that's what you follow. And when you follow that path, that's how you fall through the rabbit hole. Okay, before we dig, so what's wrong with those formulas? Nothing wrong with them, really. The problem is not in the formula themselves. They are created for good reasons. The author of these formulas are very, very experienced physicians, and they have probably very successfully applied it in their treatments against the particular syndrome that they have encountered. Right? The fundamental problem lies on what and how you use the formulas. Right? Mechanically applying them is certainly what I would say not the correct way of doing it. Key concept and TCM principles. So there's a list of key TCM principles and concepts that I will be relying on and referring to in the following slides as I talk about the various areas. So let's go through them quickly. Syndrome differentiation is probably the most important principle for Chinese medicine. And I think syndrome differentiation, I just want to make a key, differentiation here. Syndrome is not symptoms, okay? It's a series of symptoms. But it's not just symptoms or a set of symptoms in itself. It's evidence. It's evidence that we gather through our 4 main diagnostic methods. So all of these information that we gather, they compose the syndrome. And through the differentiation of these syndromes that we're able to formulate treatment principle, method, and develop the formula. Right? So that brings me to the second key point here is the alignment of the treatment principle, method, and formula is critical to our clinical practice. If we don't have a proper diagnosis through syndrome differentiation, determine what is the syndrome or the disease, there's no way for you to develop a treatment principle and method. The treatment principle and method is directly how you will approach the treatment of the syndrome or disease. How do you address the pathogenesis that you identify from a diagnosis? With that in mind, the formula that you prescribe has to align perfectly to this treatment principle and method that you have determined that will address the syndrome or disease of this patient. third point here is really about how allopathic medicine compared to Chinese medicine. I would say there's two key things that we're looking about here. The singular focus with maximum potency of the allopathic medicine versus the multi-pathway with cumulative effect of Chinese medicine. And I'll explain this later on. Also, we'll focus on some of the key concepts around the relationship between disease, pathogenic factors, patient. And when I talk about patient, it's really patient constitution. We talk about pathogenic factor in relation to etiology. We talk about how symptom is not pathogenesis. And this is very important. So these are the key concepts and TCM principles that we'll be referring back to throughout this episode. Let's look at the relationship between disease, pathogenic factors, and patient constitution. So on the left hand side here, I have a blue circle representing the patient constitution, and I label that as A. And on the right hand side here, I have a red circle representing the pathogenic factor or factors, and I label that as B. And when we combine these two, we create C, which is the syndrome or disease, right? Or at least the pathogenesis for this particular disease, right? But in Chinese medicine, we do not just focus on the C. We actually treat the entire patient. At least we should have a holistic view of the patient. Yes, we want to treat the disease and syndrome, and that's probably our first and foremost objective, because most likely that's the patient's primary complaint. But in determining our treatment principle and method, we will need to take the constitution of the patient into consideration, because it can directly impact on how effective your treatment can be. I will demonstrate that a little later, but I just want you to focus on that. In Chinese medicine, we tend to treat the entire patient, not just focusing on the specific disease, and which compared to allopathic or conventional medicine, that's what they will focus on, right? They will focus on the particular aspect of the disease. For example, if it's a tumor, okay, so they will go and try to remove the tumor through surgery, through chemotherapy, through radiation therapy, and the target is the tumor. In Chinese medicine, that is probably a primary focus, but that's not the only focus, right? We do really want to remove the tumor. We do want to stop the growth of the tumor, but we need to take the entire constitution of the patient into consideration. Is there deficiency? Is there excess? Is there heat? Is there cold? Is there qi stagnation? Is there blood stasis? So we need to apply all these factors, consider them all, and take that as a whole package. Because when you prescribe a herbal formula, if you don't take these things into consideration, your effectiveness of your treatment will greatly reduce. And that's what we want to be able to look at in a holistic manner, because that's a requirement, kind of looking at why Chinese medicine can be very effective in many types of diseases. So there's a few points I want to focus and make sure that we have on the kind of same page here. Pathogenic factor. For example, if you take wind cold invading a patient, the wind cold is a pathogenic factor. Does not equate to the pathogenesis. At least not all of it. Because the pathogenesis that you identify through your diagnosis could be identified, yes, wind cold could be a pathogenic factor, it could be the etiology why this person is having a cold, but the pathogenesis that you identify in terms of what treatment you're going to do, where you're going to treat, what are you going to treat, includes the body's constitution. That body constitution may consist of certain deficiency or certain excess or certain other factors like heat, cold, right? Blood stasis, all that stuff I had just mentioned. So pathogenesis certainly does not equate to pathogenic factor. Pathogenic factors could be etiology. I think they have a close relationship. Syndrome definitely is, in terms of volume, is much more than disease, because a lot of the time is that we don't have enough information on a specific condition, and we just call it a syndrome. And the ones that we can have in terms of figuring out the pathology, the etiology, and we'll probably promote that to a disease and we'll give it a name, right? So definitely in terms of the comparative numbers between these two, syndrome most likely is a much bigger number than disease. So a lot of time I just talk about syndrome. And the next point here is really what I just mentioned, right? We treat the patient, A and C, not just C, okay? And we derive the treatment principle and method from our diagnosis that will govern how we formulate, especially in terms of herbal formula. How that herbal formula, what herbs does that herbal formula that we prescribe has to align with the treatment principle and method. Here I want to use wind cold as the pathogenic factor to demonstrate to you the relationship between pathogenic factor, body constitution, the syndrome and disease, and from there, in terms of diagnosis of the syndrome, the treatment principle and method that you will derive to address the conditions or the syndrome or disease of the patient. So we have two formula here. They're very classic formula from Song Hun Lun by Dr. Zhang Zhongjing, Ma Rong Tang, Gui Zi Tang. These two very famous formula, they're both to address wind cold invasion into the body, creating a wind cold condition. The differences are with Ma Huang Tang is that even though it's the same wind cold invasion as compared to Gui Zi Tang, the body constitution of the patient are very different. The Ma Huang Tang, the patient constitution is what we would classify as neutral. Gui Zi Tang, on the other hand, is the patient's constitution is classified as deficient. Okay, so even though they are invaded by the same pathogenic factor, wind cold, the syndrome that we diagnose are two different syndromes, right? The Ma Huang Tang we will diagnose as being excess wind cold. The Gui Zi Tang we will diagnose that as being deficient wind cold. These two different syndromes require different treatment principle and method. So if you look at the Ma Huang Tong, the treatment principle for relieving excess wrinkle in a neutral body constitution is to relieve the exterior by diaphoresis with warm and pungent herbs. On the other hand, Gui Ji Tong, to address the deficient wrinkle, right, because the patient's constitution is deficient, the treatment principle here is first and foremost to reinforce the healthy qi, then you relieve the exterior, right? So reinforcing the healthy qi becomes a primary goal or objective of Gui Ji Tong. And compared to the Ma Huang Tong syndrome, there is no nursing or reinforcing here. We just go directly to relieve the exterior, right? And I will break down the individual makeups of the herbs of each of these formulas later, and show you how they absolutely align to that treatment principle and method. The key, I guess, ideas I want you to get out of this is that even though it may be the same pathogenic factors, when you put it into different body constitution, they actually create different syndrome. So with that in mind, the body constitution can be quite complex once you get into a clinical bedside scenario, when you're seeing a wide range of patients. Their body constitution will get much more complex. You will not have too many neutral body constitution, I can tell you that. They could be a combination of deficient, excess. They could be deficiency of different level of different things. So one could be blood deficiency, and the other one could be qi deficiency, and another one could be yin deficiency. It could be yang deficiency in different parts of the body as well. So you could have deficient coal in one channel, and then you have excess heat in another channel. So with the various organs may have in various states of health with its associated condition, excess or deficiency. You could have flame, you could have dampness, you could have blood stasis, etc. So the idea here is that different condition or different body constitution, even though with the same pathogenic factor, can create different syndrome. And if you can actually bring in the pathogenic factor, it's the same scenario, because you can apply the same concept. The invading pathogenic factor could be external or internal. It varies from wind cold, wind heat, summer heat, dampness, wind cold dampness, wind cold dryness. So it varies quite a bit. And when you mix the very complex body constitution with a very complex pathogenic factors, you're going to have many variation of syndromes, and that means you will also have many variation of treatment principle and method. So in connection to what we see here, so naturally you probably will think, wow, okay, excess wrinkle, you apply Ma Huang Tong, deficient wrinkle, you apply Gui Ji Tong, then you have it. Mechanically applying formula actually works. But as I just explained, when you're at the clinical practice, at the hospital or in clinic, you will see many complex situation, many variation of body constitution with variation of pathogenesis. And the challenge of selecting a formula that exactly matches what you need in terms of what's dictated by the treatment principle and method gets exponentially more complex. Okay, so let me go ahead and then demonstrate to you how each of these formulas, their herbs, actually matches and align perfectly to their treatment principle and method required for their type of syndrome.